we will try to write down some common causes of constipation and what clinical findings will you search during examination of a child with constipation. Uh, a 1 year child presented with constipation since his early infancy. What are the important differentials? What history will you take to diagnose this patient? How to investigate the child? Write down the management plan. So now let's talk about constipation. Constipation may be defined as the passage of hard stool with difficulty in every third day. It may arise from defects either in filling or emptying the rectum. Now let's talk about the etiology of constipation, non-organic or functional causes of constipation. Idiopathic, acute febrile illness, low fiber diet, transition from breast milk to cow's milk, forceful potty training. And there are also some organic causes of constipation, and the organic causes are anatomic, as for example, anal stenosis, anal fissure, abnormal musculature, as for example, Down syndrome, intestinal nerve abnormality, as for example, Hirschsprung disease, intestinal disorders, as for example, cow's milk protein intolerance, metabolic disorders, as for example, hypothyroidism, drugs, as for example, phenytoin, anticholinergics, psychiatric disorder, as for example, anorexia nervosa. Approach to a patient with constipation. History of delayed passage of meconium, as for example, Hirschsprung disease. History of prolonged jaundice in the neonatal period, as for example, congenital hypothyroidism. Painful passage of stool, as for example, anal fissure. History of passage of stool in inappropriate places, as for example, encopresis. Dietary history, as for example, low fiber diet, chains of diet from breast milk to cow's milk, family history of constipation, as for example, parental habit, forceful potty training, physical examination. Let's talk about physical examination. Appearance, coarse faces, hairline, protruded tongue, that means congenital hypothyroidism, abdomen, distended or not, that means Hirschsprung disease, perianal region to check for anal fissures, back to check for meningococcal or meningococcal, digital rectal examination to check for tone of sphincter or Hirschsprung disease, whether explosive diarrhea on withdrawal of finger present or not, Hirschsprung disease, muscle tone hypotonic in hypothyroidism, Down syndrome, hypertonic meningococcal or myelomeningococcal. Diagnosis based on CF and relevant investigations, plain X-ray of abdomen results to look for evidence of bowel obstruction, as for example presence of multiple air fluid levels. Investigations, barium enema, X-ray of large gut results, presence of normally dilated proximal colon and a smaller caliber constricted distal colon as seen in Hirschsprung disease. Investigations, serum TSH, FT4 results, high TSH and low FT4 level indicate congenital hypothyroidism. Investigations name karyotyping results, presence of extra copy of chromosome on 21 as seen in Down syndrome. Now let's talk about the treatment of constipation. Supportive treatment. First, counseling. Second, diet. Encourage more fluid and more fluid intake. Encourage high fiber diet, as for example vegetables. Avoid excessive consumption of milk, meat. Toilet training, regular toilet sitting for 10 minutes twice a day after meal. Drugs, osmotic laxative, that means lactulose, bulk forming laxatives, that means isopgulahax, stool softener, that means liquid paraffins, others, enema simplex, manual evacuation under GA, specific treatment of the underlying cause, if anybody, if anything. So thank you very much. Simply all about constipation in a short lecture. Thank you for your watching.